everyone. I'm Dr.Garima Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic bilious fever in English, which is also known as jaundice or icterus or yellow disease. Why it is termed as yellow disease? Because it causes yellowishness of the sclera, that is white of the eye becomes yellow, or yellowishness of the skin. That's why it is known as yellow disease. There is fever along with high bilirubin level. So bilirubin gets high or increased within the bloodstream. That's why it is termed as bilious fever. It is very common in babies than adults. 80% of the babies suffer or affected during their first week of life because of this jaundice. They suffer from it. Friends, before that, if you have not subscribed the channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos. And kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in such jaundice cases. And you can also visit my blog website, that is www.drgarimablog.com. You can read blogs there too. And clinic address as well as contact number is given in the description link. You can consult with me online too. So let's continue with this jaundice. Normal level of bilirubin is 1 mg per dl. High blood bilirubin is divided into two categories, that is unconjugated variety and conjugated variety. We will discuss it later on. Now let's talk about the symptoms of this jaundice. So the first one is yellowish discoloration of skin or white of eye, that is sclera. They become yellowish in color. There is dark colored urine because of bilirubinuria, that is presence of bilirubin within the urine, or pale urine occurs, that is because of acolia, that is absence of bilirubin within the urine. Other symptoms include nausea and vomiting, that is nausea at the sight or smell of cooking food. Patient is unable to eat anything or digest anything. There is voluptuous itching on the skin, and there is fatty stool, that is steatorrhea. It occurs. In childhood, there is one more symptom, that is yellowish or greenish discoloration of the teeth. It is because of the deposition of bilirubin at the process of calcification. Now let's talk about the causes of this jaundice or icterus. Causes are divided into three categories, and it depends on which part of physiological mechanism gets affected. So the first one is prehepatic or hemolytic. So pathology is prior to liver mechanism in this. Excessive RBC's destruction takes place in this. That's why unconjugated bilirubin gets increased. Therefore, deposition of unconjugated bilirubin takes place into mucosal cells. So the diseases involved are hemolytic one, like sickle cell anemia, thalassemia, anemia, deficiency of some enzymes, malaria, or spherocytosis, that is RBCs turn into sphere shaped instead of biconcave. So these are the causes of prehepatic jaundice. The next one is hepatic or hepatocellular. So in this, damage of liver parenchymal cells takes place. It may be due to infections or may be due to drugs, medicine induced, some genetic causes may be there. As liver is involved in it, so the diseases of liver are the main cause of it, like acute hepatitis or chronic hepatitis, or cirrhosis of liver, alcoholic liver disease, or any autosomal disorder, autoimmune disorder, or genetic disorders of liver. So these are the causes of hepatic or hepatocellular one. And the last one is post-hepatic cholestatic. So as the name suggests, pathology is after, that is post-liver. So it is in the biliary tract. There is obstruction in the excretion of bile juice. That's why it leads to cholestatic jaundice. Bile duct that transports the bile or excrete out the bile from the liver to the outside gets blocked, which contains conjugated bilirubin in it. That's why it is also known as obstructive jaundice. So the pathology in this is post-hepatic one because biliary tract gets obstructed in it. So the diseases are cholelithiasis, common bile duct gallstones. Another one is pancreatic cancer, biliary stricture, biliary atresia, that is absence of bile duct, or biliary cholangitis, inflammation of the gallbladder leading to strictures of the bile duct. So these are the causes of post-hepatic jaundice. Some pancreatic diseases are also responsible for the post-hepatic variety, that is inflammation of the pancreas, either acute or chronic one. Or pancreatic pseudocyst can also be responsible for post-hepatic one. Now let's talk about the diagnosis of this jaundice. Physical examination is more than sufficient, yet liver function tests are also applicable for this. Ultrasound, CT scan, urine tests are also helpful. Checking the level of GGT, PT, ALT and AST are also helpful in the diagnosis of this jaundice. Now let's talk about the complications of this jaundice. So this is kernicterus. That is, if bilirubin level gets too high, that is hyperbilirubinemia, and if it gets accumulated in the white matter of brain or CNS, so it may lead to severe neurological disorders or disturbances, which leads to this kernicterus. Now let's talk about the treatment part. So it is based on the underlying cause. Friends, now let's discuss about the homeopathic approach for this jaundice. So at first we will discuss about the cause of this jaundice. So the homeopathic cause is fear of starvation. Patient feels that he is going to be starved in future. So this is the cause of the jaundice. Now friends, let's discuss one of the acute case of jaundice. Patient is suffering from fever since 2 days with severe chill, but he is having aversion to cover, doesn't want to cover. There is cold sweat, coldness over whole body, but there is burning inside the esophagus. There is aversion to drink anything. Patient doesn't want to drink anything. Internal chilliness is there, but there is burning heat all over too. Patient drinks but only little at a time. There is violent thirst but aversion to drink water, and there is canine hunger during fever, loose watery stool, mucoid diarrhea, and patient feels that as if bowels were full of water only. There is severe pain in the abdomen along with it, and aversion to vegetables, fruits, apples. On the basis of thorough evaluation and analysis, medicine prescribed was Haliborus 200 and patient got completely cured. Now friends, let's discuss some of the homeopathic medicines which can be helpful in curing this jaundice. So the first medicine is Baptisia. It is very good medicine for jaundice as well as typhoid. There is fever, high grade fever with sweat, and sweat relieves the patient. There is too much pain in the liver region. There is abdominal pain. There is fetid odor from the mouth as well. Patient can swallow liquid but can't swallow any food. Means he can drink liquid easily but can't swallow food. So this is the very peculiar symptom of this Baptisia. He is unable to eat anything. As soon as he eats, he vomits it out. There is diarrhea, and diarrhea is bloody, very offensive, putrid, and there is too much offensiveness and delirium with this diarrhea. There is mental confusion, aversion to any kind of mental work is there in this baptasia. Part feels separated. He is hopeless of recovery. So if these symptoms correspond, baptasia will be helpful in such cases. And the next medicine is chelidonium. It is also known as liver tonic. There is high-grade fever with sweat and patient is having aversion to uncover. Patient wants to cover. There is sluggish bowel movement, but nausea and vomiting is too severe. And it gets ameliorated from drinking warm water. He wants to drink even at the stage of boiling. That is boiled water he wants. He craves for it during nausea and vomiting because it ameliorates him. There is lack of vital heat. Patient feels internal chilliness. And mentally he is having an aversion to any kind of mental work. And he has delusion that he has ruined his health. He always feels tormented. If these symptoms correspond, chelidonium will be helpful in such cases. That's all for this topic. We'll meet soon with a new topic, new subject. Kindly subscribe the channel, tap the bell icon to get the latest updates of the video. The clinic address of mine and the contact number is given in the description link. You can consult with me online too. The numbers are 9407182305, 9131992857. You can also read my blog on the blog website, that is www.drgarimablog.com. So you can go there and visit there. You can read the blogs. It can be helpful for you. So stay connected, stay healthy. Thank you.